Back. The chair now recognizes Mr. Bilirakis from Florida for 5 minutes for questions.
Thank you, Mr. Chairman. I appreciate it. Dr. White, recent reporting has discussed higher incidence of cancer among younger Americans, unfortunately. To the extent this represents better and earlier detection, this is a good thing, but I fear that's not necessarily the case. This shines an important light on the need for better, earlier, and more efficient detection of cancers and other deadly diseases. How can we incentivize better use of preventive services that ultimately lead to save money in the long run? Whether that, and I know that my good friend over here, Morgan, discussed this with you, whether that be through new screening technologies or finding ways to prevent hospitalization. If you could elaborate on that, I'd appreciate it.
Sure, thank you. So in terms of screening and whether it's cost saving or cost increasing, part of it depends on the cost of the test itself. And if you have to screen 100 people to detect anything, that's going to tend to be cost increasing. The cost per test matters a lot. The other question is this going to lead to people being treated earlier in a lower cost way, or is it going to lead to a larger pool of people treated when the condition wouldn't necessarily have advanced, and they might, especially in the Medicare population, there are a lot of competing risks. Treating someone early may end up treating a condition that wouldn't have become clinically symptomatic, and that may just add to treatment costs. So the cost of the test, how sensitive it is, how specific it is, and the characteristics of the disease progression all matter. And I feel bad saying it depends, but depending on the test and the clinical condition, it really changes the calculation of whether it's cost increasing or reducing.
Okay, thank you. Again, my friend, Mr. Morgan, told us that, the one test, screening test, costs $1,000. That makes a lot of sense to me for early detection. So, and it saves money in the long run. Of course, increases a person's quality of care as well. Ms. Martin and Mr. Lyons, beyond premiums, both insurers and employers should have mutual financial incentives to keep employees healthy, and particularly on the front end through prevention and screenings. What ways are there collaboration between these two in a cost-effective manner? And then Dr. Ippolito, if we can follow up with this, how does price transparency help them meet this goal? So let's hear from Ms. Martin first, and then Mr. Lyons, then Dr. Ippolito.
Unfortunately, I'm not familiar with ways that employers and insurance companies are teaming up. That's beyond the scope of what we look at HCCI.
Okay, Mr. Lyons.
Yeah, thank you for that question. In New Jersey, what we did, we took an aggressive stance on primary care, and we've opened up several primary care centers so to make sure people have constant access. Because if you know right now, primary care is dwindling in the marketplace because of the reimbursements and doctors fleeing the profession. But what we did, we started a series of, first it was just for the general population of the state health benefits plan. And then what we did, and that price is very transparent, it's separately contracted. We started a first responders primary care health center, which I actually moved the resolution to get that done in New Jersey, and very proud of that. So we think that's the first way to get it moving. And then price transparency in general is going to allow people to make decisions. And I think transparency ultimately drives down price, right? Because, like I said, it'll shock the conscience. The best disinfectant is sunlight, right? So, thank you.
That makes sense. And I know that Dr. Bouchon will probably elaborate on that too, because he has several stories. Again, Dr. Ippolito, how does price transparency help them meet this goal?
Well, I think we can think of employers as being one of the few entities in healthcare markets that perhaps have a medium to long run view. They care about their employees over the long term. And so greater information, particularly along the lines of what's the more, the law we're talking about, or the bill we're talking about, will help them choose benefits that match their employees better. It helps them investigate where they're spending too much money relative to what they want. So it's a clear first step.
All right, very good. Thank you. I yield back, Mr. Chairman.
Gentleman yields back. The chair recognizes